In a bold move set to reshape the landscape of public health and consumer behavior, the 2025 Dietary Guidelines that's being proposed by the U.S. Department of Health and Human Services and the U.S. Department of Agriculture are recommending that no amount of alcohol consumption is safe. This marks a significant departure from previous guidelines, which have traditionally suggested that moderate consumption, up to 1 drink per day for women and 2 drinks per day for men, as permissible part of a healthy lifestyle. Now, this shift is poised to send ripples through the beer, wine, and spirits industry, challenging both their business models and marketing strategies. This could have a huge impact on these wine, beer, and spirits brands and on retailers, everyone from liquor stores to supermarkets. The alcohol industry is a significant contributor to the global economy, generating billions of dollars in revenue annually and providing employment for millions. In the United States alone, the industry supports over 4.4 million jobs and contributes nearly $360 billion to our economy. A categorical recommendation against alcohol consumption could lead to a decline in sales, affecting not only large corporations, but also small businesses such as craft breweries and local wineries, which have seen a substantial growth in recent years. Nothing more about restaurants can be said. Consumer perceptions of alcohol have been evolving, with increasing awareness of health risks associated with excessive consumption. However, a federal guideline explicitly stating that no level of alcohol consumption is safe could accelerate this shift, leading to a decline in demand. This change may drive consumers towards non-alcoholic alternatives, a market that has been burgeoning with innovations like alcohol-free beers, wines, and spirits. Companies may need to pivot towards these products to maintain market share and meet changing consumer preferences. So, what can the alcoholic beverage industry do? Well, the alcohol industry has had a history of robust lobbying efforts, and this proposed guideline is likely to intensify these activities. Industry groups such as the Distilled Spirits Council of the United States and the Beer Institute may intensify their efforts to challenge the science behind the guidelines, advocating for a more balanced approach that recognizes moderate consumption. Engaging with policymakers to present alternative perspectives and data could be pivotal in shaping the final recommendations. But for me, one of the most important efforts for them is to educate consumers about responsible drinking. Sober October and Dry January have made meaningful strides in creating awareness. These campaigns' primary objectives are designed to shed light on the dangers of alcohol misuse and encourage people to reflect on their drinking habits. In 2023, over 56 million people in the U.S. participated in Dry January, and the results are that these people reduced their consumption in the following months by stopping drinking 1 day a week. By promoting awareness of moderate consumption and its place in a balanced lifestyle, the industry can counteract the potential negative perception created by these new guidelines. The rise of non-alcoholic beverages offer a significant opportunity for the industry. Beer, wine, and spirit companies that invest in developing high-quality, flavorful alternatives to traditional alcoholic drinks may find new revenue streams. Focusing on health-oriented product lines, such as low-calorie and low-sugar options, could appeal to health-conscious consumers. Looking at global precedents can offer insights. In countries like Canada and Australia, where stricter alcohol guidelines have been implemented, the industry has seen mixed impact. In Canada, increased emphasis on health has led to a rise in non-alcoholic options and a gradual cultural shift towards moderation. In Australia, extensive public health campaigns and government policies have successfully reduced harmful drinking behaviors while maintaining a robust market for responsible consumption. What these brands and retailers need is a collaborative approach between the alcohol industry, public health officials, and policymakers to pave the way for a more balanced guideline. By working together, these stakeholders can develop recommendations that protect public health without unduly harming the economic and social fabric supported by the alcohol industry. Initiatives such as promoting responsible drinking, improving labeling transparency, and supporting mental health and addiction services can address the health concerns without necessitating an outright rejection of alcohol consumption.